With kids heading back to school, parents may worry again that the close quarters of a classroom could easily spread illnesses and germs. Well, there's another thing parents need to keep a watchful eye out for. Dr. David James explains in this week's Health Watch.
It may not be dangerous, but it's contagious, common, and downright annoying. Head lice is caused by a parasite that lives among human hairs, especially in school-aged children.
It's more of a nuisance than anything else. It doesn't come from being dirty, so it's not a nasty thing. You don't have to be ashamed because you have head lice.
Still, though, some schools have policies in place restricting children with head lice from entering the classroom. So it's important to recognize and treat head lice if your child begins to show the signs.
Itching, you can't miss it. Their heads will itch, they'll scratch and scratch. And you may see a rash on their neck, or sometimes you can even see the bugs in their hair or the nits that are glued to the hair shaft.
The presence of nits are also a way for parents and teachers to detect head lice.
The nit is actually the egg that the louse lays, and it sticks to the hair shaft. So it looks like dandruff, but if you can't pull it off, it may be a nit because it's glued to the shaft. So that's one way to know the difference. If you can slide it off, it's not a nit.
Though head lice don't jump or fly, they do spread easily. So speak to your child about ways to prevent getting it.
Encourage them not to share hats and combs and brushes. That's a big one. Little kids, they're going to have heads together, and so they may get the lice. If there's a child that they've had contact with, they may get head lice themselves, but it's not a reason to panic. I don't think anybody's ever died from head lice.
There are many simple ways to treat lice. It's recommended you use an over-the-counter treatment method first from your local pharmacy. If the condition persists, or if there's question about whether nits are still active in your child's hair, then seek assistance from your child's health care provider. For this week's Health Watch, I'm Dr. David James.